In today's video, I'm going to be talking to you about what premature ejaculation is and discuss some of the ways to help with this problem. My name is Wale Olabobwe. I'm a medical doctor and a reproductive health advocate. You're welcome. If you're new here, I want you to know that this channel is dedicated to improving your health and wellness. And if you haven't subscribed yet, do well to click on the subscribe button and hit the notification bell so you do not get to miss any of our videos. So let's start. Premature ejaculation occurs when a man ejaculates during sexual intercourse sooner than when he or his partner would like. This is a common sexual complaint, though figures vary, but as many as 1 out of 3 men complain of having this issue at one time in their life. It is a common condition which could be embarrassing, such that men do not even like to talk about it, even with their doctors and their partners. If this happens occasionally, then it is not a cause for concern, but one may be diagnosed with this condition if 3 of these factors are present. 1. If the man always or nearly always ejaculates within 1 minute of penetration. 2. If he is unable to delay ejaculation during sexual intercourse all or nearly all of the time. 3. If the man feels distressed or frustrated and because of this tends to avoid sexual intimacy with his partner, we can conclude that he may be suffering from premature ejaculation. What are the causes of premature ejaculation? The first thing I'll talk about is biological factors, which has to do with the adequacy of the chemicals that control the processes that leads to ejaculation. Secondly, there are varying psychological factors that can cause premature ejaculation, and these include a feeling of guilt. Take for example, a man is trying to have sex against his value system. There's every tendency that this man will experience premature ejaculation because he's just going to rush in and rush out. In addition to this, when a man is anxious about impressing his partner, there's every tendency that he will end up experiencing premature ejaculation. Lastly, when there are unresolved issues in a relationship, premature ejaculation is bound to happen. Another key factor that can cause premature ejaculation is advancing age. As the man increases in age, so is the tendency to experience premature ejaculation. Other causes of premature ejaculation include erectile dysfunction. This is the condition in which the man is unable to sustain erection. Almost always, premature ejaculation goes with erectile dysfunction. In addition to this, medical conditions like hypertension, diabetes mellitus, excess thyroid hormones, and obesity all can cause premature ejaculation. Lastly, withdrawal from recreational drugs such as cocaine, marijuana, all can cause premature ejaculation. How do you treat premature ejaculation? The first thing I recommend is physical exercises of at least 30 minutes in a day for a minimum of 3 days in a week. This is said to improve the symptoms of premature ejaculation. Next to that is pelvic floor exercises such as the Kegels exercise, which improves the strength of the pelvic floor muscles. This is achieved by starting urinating and holding back the urine and repeating this process for a number of times in a day. Or if you don't feel like urinating, you can pretend to urinate and hold back the urine. In addition to physical exercises, the next thing I'll talk about is psychological or sexual therapy. This is a major backbone of any form of treatment you may seek. There are also behavioral techniques which can help to improve symptoms. One of these is the Siemens technique, also known as edging, and also known as the start-stop technique. This is when the penis is stimulated up until the man feels the urge to ejaculate. At this time, the stimulation is stopped and the urge to ejaculate is allowed to subside for about 30 seconds, after which this process is repeated for about 3 to 4 times. What this does is that it helps to retrain the biological system that controls the process of ejaculation. The second behavioral technique we'll be talking about is the squeeze method. In this method, the penis is stimulated up until shortly before the man feels the urge to ejaculate. At this point, the head of the penis is held either by the man or his partner and squeezed until the penis loses erection partially. This process is also repeated about 3 to 4 times, and as the same as technique, they are aimed at achieving the same result of retraining the process that controls ejaculation. These two behavioral methods gives a short-term success rate, which is very encouraging. The next on my list is condoms. Condoms technically reduces the sensation felt by the man, and of course, reducing sensation tends to delay ejaculation. The next on my list is topical agent, which contains chemicals that helps to numb the skin. Numbing the skin of the penis reduces its sensitivity and therefore reducing the risk of premature ejaculation. Now, these products have their specific directive for use. You have to always read the manufacturer's guideline before using any of these products. Lastly, there are certain drugs whose side effect is to delay ejaculation. Example of such is some antidepressants. This is an example of which side effects of drugs becomes beneficial in treating other conditions. But note that these drugs are not prescribed off the counter. You will need a prescription from your doctor in order to purchase these medications. Before we round up, I would like to do a little recap on what we've talked about. Premature ejaculation is when a man ejaculates sooner than when he or his partner would like to. It should be individualized. It's a common condition affecting men, so we should feel free to talk about it. Don't be embarrassed to talk about it with your partner or with your healthcare providers. And also know that there are a lot of treatment options available for you. I hope this information has helped you to understand premature ejaculation and how you can get help. Click on the subscribe button, like our videos, watch our previous videos. I know they are quite educative. Keep your questions coming and don't hold your comments back. I'll see you in my next video. Till then, stay healthy.